Bladder and bowel problems affect millions of people, men and women, young and old alike. Yet despite being the most common problem facing carers in both hospitals and the community, it's probably the most misunderstood and mismanaged of all conditions. Many healthcare professionals view incontinence as an inevitable consequence of the ageing process. However, although incontinence can be a very upsetting condition both for those suffering with it and the people around them, it's important to remember that everyone with incontinence can be helped, and many can be completely cured. Nurses and carers are in a unique position to positively promote continence. By understanding the individual's problem, adopting a sensitive and caring approach, and working together with them, it's possible to greatly enhance their quality of life. It's essential that an individual assessment is carried out, which includes a detailed medical history and produces a frequency volume chart in order to establish a clear idea of the patient's voiding pattern.
As a company, we would recommend that any patient that is needing to be managed in an incontinence product is first assessed by a healthcare professional with a full continence assessment. The continence assessment will look at things like their mobility, like their medical history, their medications that they're on, what's their fluid intake, what kind of diet do they have. Lots of information to gain a picture of this patient. We look at that information that we've gained, which will then help us assess for the most appropriate pad.
With our shaped range, the size, they are designed that each pad should suit most individuals' needs. It's then just determine which size net pants will work best with that product. It is just taking that waist measurement to determine which size product or underwear is required to work alongside.
Sometimes it can be difficult to establish straight away which is the most appropriate absorbency, so some areas they may have to trial a product first. Some areas we've performed pad weighing, which can give us a more accurate reflection of what they're passing. So again, looking at continence assessment to give us that information of which absorbency, but we may also look at other things like trialling products. We have wetness indicator lines on the product, so they're there to be used as a guide as to when to change a pad. We generally say look for the majority of the line, the indicator line, the yellow line will turn dark blue, the blue line will smudge and fade. So that can be a guide as to when to change. Obviously, if a patient is fecally incontinent, then we would always recommend that the product's changed straight away. We would recommend that when applying a pad to a patient, you would ideally apply from the front, and then if you're removing a product, you'd remove from the back. Try to remove it carefully, keep it cupped to prevent any spillage, removing the pad from the patient. And then obviously dispose of it appropriately. If there is clinical waste bins supplied for disposable, to dispose in that way.
When using any of the Ontex products, we always say only ever use one product at a time. We shouldn't ever be using two products at once. That's a form of double padding, which we don't recommend as a company.
When you remove the product from the packet, we recommend that it's folded lengthways and shaped. But when applying the product, we would say try to avoid touching the inside of the product, and also try to avoid twisting and shaking the product excessively. All that's needed really to get the product in shape is to cup it, fold it lengthways.
We say try to use the smallest pad that will meet their needs. We don't want to go for big products that they don't actually need. A couple of reasons really, for comfort, dignity and for discretion as well.
When carrying out a normal wash, use a mild soap to minimise the risk of irritation to the skin and gently pat the skin dry. Do not rub in and avoid using large amounts of cream. Only use creams prescribed by a doctor or nurse, gently massaging a small amount into the skin in the direction of hair growth. Always apply creams directly onto the skin, not to the pad. If barrier creams are used, they should be applied sparingly and only on treatable areas. The use of talcum powder is not recommended. It may cause friction and damage the skin. Make sure skin care is attended to on a regular basis. ID Expert, your trusted partner in continence care.